Alright, benign prostatic hyperplasia is a growth of the prostate. And the symptoms that are going to be associated with benign prostatic hyperplasia are going to be due to this benign growth of the prostate. So most often patients present with trouble with urinary retention, nocturia, which is peeing at night, weak stream. So when they're peeing, they're not able to hold their stream. So it kind of dribbles. And then as well as straining while going to the bathroom, straining to urinate. We also see an increase in urinary frequency. And remember, all these symptoms are due to the enlargement of the prostate that is going to result in compression on the urethra that is going to make it hard for the patient to urinate. Now, on the digital rectal exam, what we would expect with benign prostatic hyperplasia is a large, smooth prostate without any nodules. And this is important because if there are nodules, then we would be suspicious for a cancer. So if it's not smooth and if it has nodules, then there will be a suspicious finding for cancer. Now we would see an increase in PSA. The reason for this is we have more prostate tissue. If we have more prostate tissue, we're going to be producing more PSA. So it makes sense. Now we would also see some hematuria. The reason for this is as the prostate grows, it is going to need more blood vessels, and these blood vessels are very friable and they can bleed when they're irritated. So we can also expect to find some hematuria. Now here is a normal prostate and here is a enlarged prostate on the right. Now, as you can imagine, the growth of this prostate has really compressed the urethra, and it is going to cause all the symptoms for trouble with urination. Now, as you can imagine, if the urethra is compressed like this, urine can build up in the bladder and then it can go back up through the ureters into the kidneys, and then this can result in kidney injury. Okay, so this is very important because it can irreversibly injure the kidneys, and this is known as hydronephrosis. Now let's talk about some of the medical treatments. For treating benign prostatic hyperplasia, we would give the patient alpha-1 adrenergic receptor blockers. An example of this is tamsulosin. It is going to relax the smooth muscle found in the bladder and the prostate, and this is going to improve urine flow. So let's write this down. It's going to relax the smooth muscle in the bladder and the prostate to increase urine flow. Now, another medication that we can give the patient is going to be a 5-alpha reductase inhibitor. Right? So normally testosterone is converted to 5-alpha reductase. Normally testosterone is converted into dihydrotestosterone with 5-alpha reductase, and dihydrotestosterone is responsible for the growth of the prostate. And if we give the patient a 5-alpha reductase inhibitor like finasteride, then we will have less DHT and as a result less growth of the prostate. So let's write this down: 5-alpha reductase inhibitor. Finasteride is an example of this. Right, so normally we said testosterone is converted to DHT with 5-alpha reductase acting as an enzyme that is responsible for this conversion. And so if we inhibit 5-alpha reductase, what we would have is low levels of DHT, and we said that DHT is responsible for prostate growth, and so we would have less prostate growth. A surgical treatment that is used for this is a transurethral resection of the prostate, also known as TURP. Right, and the doctor is going to place its instrument inside the urethra, and then it is going to remove the prostate in pieces. And so what can happen is by removing the pieces of prostate, we're going to be able to open up that urethra, and then it is going to be able to pass urine easily. So here is a image that is going to really show the conversion of testosterone to dihydrotestosterone. So 5-alpha reductase is the enzyme that is going to help with this reaction, and then we can use finasteride to inhibit this reaction, so we will get less dihydrotestosterone, and then we will ultimately have a less growth of the prostate as a result.